It's about 5 o'clock on June 3rd. We fell asleep for a nap. A little late. But here goes round 2 eye drop time. So she said only pull the lower lid down. She didn't say pull the other one up. Last time you tried to pull it up and that kind of hurt, so I think you just want to get the bottom open enough just to accept the drop. I don't know if I can see yet out of my right eye. There's some light. I know that I can see light, so I'm not blind. I know that's weird, but I was concerned. I already have, my vision was 2200 going into Plaque, and they say it gets worse right out of Plaque. It gets a little better, but then it gradually gets worse after that. So earlier I couldn't see really any light, and I can't open my eye to see if, so I was just wondering if I was blind. But I can see light. I'm not going to try to open my eye because I'm doing good. It doesn't hurt. It's not uncomfortable. It's not bothering me. So I don't want to do too much. Surgery was just 8 hours ago. So I don't want to do too much and put myself in pain. So I'm not trying to open it and see if I can see or anything. Just trying to let it heal. Go ahead, babe. Was it Was that a full drop?
It's a full drop, honey.
Was there any blood on my gauze?
A little bit.
A little?
Just a little.
Like just a spot, or?
Oh, shoot.
Can you just show me the gauze?
I didn't take the gauze all the way off.
Oh, okay, you're using the same gauze?
Yeah.
Well, that's not so bad, I guess. That's probably a little just watery, you know. I think I'm draining over here. That's okay though. So you got my eyelid open just enough to where I can definitely see. I can see movement. I can see movement over here, but so at least I'm not blind. Not yet. Yeah. I think it might be tucked under right here. No. Like right here, the gauze, is it tucked under?
Yeah.
Because it feels like it. It feels uncomfortable. Pull it up and untuck it and let it lay. Ah.
That better?
Yeah. Thank you very much. No, it's tucked. You got. I move the gauze up just a little or something. I just don't want it to apply pressure to my eye, you know.
Yeah, is that better?
No, that's good. That's real good right there. Thank you, babe.
How's that feel?
Not bad. the eye drop didn't burn. I felt it go in. It was cool. It didn't burn this time. It didn't burn bad last time. But also, this is day one. I think I only have to do this for the first day. Every time I get eye drops, I have to do. I need a tissue, a good tissue. Every time I do eye drops, I have to do the little machine here. And anybody who's had surgery on the upper abdomen usually have to do it. So one thing I've learned in Dr. Minturn's office that they stressed is people wipe their eyes. That's a term, wipe your eyes, right? Wipe your eyes. What I learned in Dr. Minturn's office, and they stressed it, and it's something that my wife picked up on, and she says every single time now, and reminds me, which in my rational brain is like, okay, I get it, but it's ridiculous. But in my logical brain, at the same time, I don't know if that makes any sense. I'm like, oh, okay, yeah, I see. But they said don't wipe, blot, because if you wipe, you can scratch your retina. And my wife must be severely concerned about that, because every time I wipe my eyes, don't wipe, blot. But you should remember that. For whatever reason, don't wipe, blot. Just lightly blot. And then you don't take a chance with scratching your retina if something's under your eyelid or whatever, and you wipe.
Not your retina, just your lens.
Oh, my lens, sorry. Lens. I'm still learning all the terminology for this disease, for eye functions and the way the eye is, the eye parts and all of that. That's right, my retina is on, I can't say, so I'll sound stupid. So that, so yeah, might as well just do this right now. So I have to get to the mark, and I guess hold it. That's what I've been doing until I stop breathing. So I got to do 10 to 12. Here we go. 1. Yeah, you can't blow, you gotta suck. So yeah, you will cough, but I think that's the point. It's not the point, it's to get you to where you don't cough, but I cough every time. 2. 5. What? 6. Pam says nobody wants to watch me do 10 of these. Maybe someday. Pam will be sitting there saying, oh, I'm so glad he recorded himself doing 10 of these. 7, 8, 9. So I'm doing pretty well with this. And 10. An initial one. Thank you, babe. That initial one, every time I do it, makes me cough. Then the others seem to go pretty well. So, this is me. Day 1 post-plaque. I gotta tell you, I don't feel anything. Coming back from surgery, I had all this energy for some reason. I felt good. I wasn't in pain. I wasn't tired. Even though we traveled yesterday, we didn't get into the hotel until maybe 11 p.m. And we had to unload the car. We're going to be here for 5 days, so we had to unload the car, get our room set up, and then go to bed. 11:30, 11:45, I think. Maybe, who knows? I don't even know what time it was. But then at 4:30 this morning, I woke up. My wife was already in the shower. Then I had to jump in the shower. I had to antibacterial soap with Dial. I just went to Myers and bought Dawn antibacterial soap. Yeah, not Dawn, Dial, sorry. So I had to do that. I had to shower last night when we got to the room. Then this morning before we left. And that's just a precaution for surgery. So I was up early, and I had all this anxiety about surgery, right? Like anybody does, going into it. And everything went really, really well. Went really, really smooth. I gotta tell you, the nurses at Franciscan Hospital are absolutely amazing. They're all angels. But not only that, Dr. Plaque, the anesthesiologist, Dr. Lobo, the radiation safety doctor, and especially Dr. Minturn, they have a level of care and concern and just patience that is on another level. They really make you feel like you're in good hands. They know exactly what they're doing, but they're willing to allow you to talk, to ask them questions, to understand what's going on, rather than walking in the room saying, well, we're doing this, let's get it done, and walking out of the room, leaving you feeling like, but what about this, or what about that? One concern that I had was that my initial visit with Dr. Minturn, my tumor is 13 millimeters by 13 millimeters by 5 millimeters, which is considered a medium tumor. And Dr. Minturn, when he was explaining to me, like, basically my treatment options and expected results from those treatment options, he referred to a study that he was a part of with 1,000 patients with medium-sized tumors, from small medium to large medium, over the course of 12 years. they studied and followed these patients that had both brachytherapy and enucleation. And anyway, leading up to my surgery, I got online, and in one of the groups, one of the ocular melanoma groups, I actually met someone that was getting their brachytherapy done today. Amazingly. I met her like last Tuesday or Wednesday online. And she asked me if I was part of the trial. I was like, oh no, I wasn't asked to join a trial. But I didn't want to call and bother Dr. Minturn's assistant, because I've probably been driving her crazy for a couple weeks asking her questions, which is natural, and she's an angel for all the patients and just feeding me information that, and easing my mind about things. But I was able to ask Dr. Minturn today, about that trial this morning. And there was no hesitation or anything whatsoever in the fact that he just said I didn't qualify, and he took the time to explain why I didn't qualify, because my tumor is within 3 millimeters of the macula of my perfect vision, proper vision. I forget the term he used, but that's what disqualified me, because her tumor is, I can't remember quite, I think it's 10 by 10 by 3. So I felt like we were still in the medium category. Hers might be considered a small medium. Mine's a medium. But, like, my wife and I talked about it, and we're like, yeah, there's got to be there's a reason probably. Because I think she also had a uvea that was discovered like 12 years ago, and I could be wrong. So I was like, well, my wife was like, well, maybe it's related to that. There's got to be a reason. And come to find out, her tumor is further away from the macula, and that is that's the core of this study. You have to be outside of perfect vision and away from the macula. But it was nice because he took the time to explain it to me, to tell me why, and he's so genuine and caring. He went out and after surgery and told my wife that surgery went brilliantly, that I was a superstar patient, that he's never seen such a amazing patient before, ever. I'm just perfect. And wait.
He didn't say that, honey.
What are you giggling at over there?
Because he didn't say that. He said his placement was perfect.
Oh, his placement was perfect. Well, let me tell you, I like a confident doctor. I don't like an arrogant doctor, but I like a confident doctor. And I guess after 40 years and, doing thousands of plaque placements, I guess you get pretty good at it. But when we were prepping for surgery, or when we were prepping for surgery before the doctor came in, somebody had mentioned that Dr. Minturn has two of these surgeries today. I think last month he had 5 plaque placements, plaque surgeries. Today he had 2 plaque surgeries. I didn't see the other patient when they came in. But my head was in another world. I don't know if my wife saw anybody, because my wife was going to try to connect with other patients from this class of of plaque therapies, if that's what you want to call it. So I was the first surgery, and then when Dr. Minturn came in, I mentioned the clinical. He knew who I was. He said, "Oh yeah, she's in the clinical," and he was like, and what my wife mentioned was how he had also said that, we really, when there's a trial, we really like to invite and accept everybody we can, because it helps with the research and knowledge and moving treatment forward. When I got or after surgery, I was out of recovery. I was back in my room in the hospital, and I think I was ready to get dressed and leave, and they mentioned that the second patient, actually they called over the radio. They called my post-op nurse and said that the second patient was ready to be moved from recovery into her hospital room to get her ready for discharge. So I hope she's doing well. I reached out to her when I got back out to the hotel, and I left just a Facebook comment. But I hope she's doing well. My whole point of all of that was I had so much anxiety, very little sleep. But then when I got back to the hotel, I felt so good. I wasn't in any pain. So far, the stitches aren't bothering me. And so I took a walk with my wife down to the hotel pool. And then we took the baby outside to go potty. And no one was around us, so don't freak out about radiation exposure. My wife was not close to me. I have to maintain 6 feet of distance between myself and my wife, and my baby, who is just a little 2-year-old dog. She's only 4 pounds, but her name's Baby. And then we came back to the room, and my wife wanted a nap. And I just wasn't there. But then so I messed around the room, organized the room, hooked my laptop up to the TV so we can watch Netflix. Not a smart TV. Which is probably good, because I worry about putting my password into a smart TV and then leave it there, and then people mooching my sub afterwards, which is fine, whatever. So we settled in. We found something to watch on TV. My wife maybe watched 60 seconds of it before she was snoring and waking up the neighbors in the other room. They come, start beating on the door. I'm like, yes. They're like, can you at least turn the bullhorn off? What? What are you talking about? They're like, what's the growling going on here? Growling? What? And then she did it again while I was standing there. I'm like, and I could not deny it. So I just backed away from the door, shut the door, and then walked back to bed, and I'm not allowed within six feet of my wife, or I would have put a pillow over her head.
Stop it.
No, sorry, a little too far. Too far?
Too far.
Okay. Love you.
I love you more.
But anyway, I crawled into bed. My wife was asleep almost instantly. I watched a couple of minutes and decided I would roll over, and I fell asleep. I will say that I slept very well last night for the short time that I did. I was comfortable. I was tired enough to sleep through. Didn't have any issues. So we probably slept for... What time do you think we fell asleep? 1 o'clock?
Maybe 12:31.
Yeah, 12:30 or 1. And I actually woke us up because I'd slept wrong and my hip was just...
Oh no! Before the nap, we went to bed at 2:30.
Oh, 2:30, so it wasn't that long of a nap. So we fell asleep at 2:30, and I woke us up a little after 5. My hip was in a bad spot, and we did the second round of eye drops, which now we're at 26 minutes, which is good. I know I've rambled, but I've got to try to get these... I have to get used to talking on camera. Not that I'm new to this or YouTube or anything else, but I don't usually put myself out there on camera. So I've got to get used to talking on camera. I've got to get used to keeping my thoughts straight and being able to circle back around and finish a thought so that people aren't like, but what about this? And I need to be able to extend these videos beyond 30 seconds, 60 seconds, 2 minutes, 5 minutes, 10 minutes. I'd really like to get these videos to a little over an hour, 59 minutes to between 59 minutes and 70 minutes, which is just over an hour. While a lot of it is just rambling that nobody's going to care about. I think at some point down the line, the video has value for people that care about me, for people that may be getting ready to go through what I'm going through right now, or for some other personal reason. Even though it's just me laying here rambling, I feel like at some point in time, someone will appreciate it for their own reason and understand and not judge me. I thought about it earlier and I wanted to mention the ocular melanoma community is so amazing. I have to give a shout out to Ashley McCrary, to Melody with a Cure on Insight, her daughter, her crew that works with her at the organization, the people in my ocular melanoma Facebook groups. It truly is my safe place where I can go and people really understand because they're going through it. If you don't know Ashley McCrary, look her up at aneyeongrace.net. She's an angel doing great things, helping patients travel, helping with their trip costs like hotels, gas, food, this, that, whatever. She has ocular melanoma as well, and she has a very inspiring story. And I've just got to say, between all these people, they have really lifted me up. They've lifted my spirits. It's the only thing that I do on Facebook anymore is catch up with comments, catch up with new posts, and I find love, I find compassion, I find support, and I find a place where I can talk about it and not feel like it's irrelevant, because nobody understands this disease. Nobody knows what this disease is. Nobody understands the severity of this disease. It's funny that I bring that up, because people really don't, and you can't fault people for not knowing or understanding. 6 weeks ago, when I was diagnosed, I had never heard of ocular melanoma in my life. I may have at some random points in my life, heard about dilated eye exams, but that even less have I heard about freckles in my eyes. But I never processed how important it is. My entire life, I've never had an eye exam. Never needed an eye exam. I always had perfect vision. Whenever I did like my driver's tests and physicals and things like that. But I was never advised to get a dilated eye exam. I was never, advised that I need to know if I have freckles in my eye. Turns out that that's as important as knowing what's going on with your heart, knowing what's going on with moles and freckles and spots on your skin. It's as important as knowing anything else about your body. You should know your eyes, because they see everything. And if you don't know your eyes, ocular melanoma can really grow and develop without your awareness. And it's an incurable disease, and it sticks with you. Right now I'm having radiation therapy to kill the tumor in my eye. So the battle has begun. But ultimately, ocular melanoma will win the war, regardless of when it is, unless I have a tragic accident. Because it lives in the blood. So I can't donate blood anymore. I can't donate my organs, because I could potentially pass that on to someone else who could metastasize in their system. But that's what it does. It lives in my blood. I have a 50-50 chance, regardless of inoculation, regardless of brachytherapy, regardless of anything. Ultimately, I have an average of 50-50 chance of it metastasizing. There are people in the group that have gone 10, 12, 20 years without it metastasizing. God bless them, and may they remain healthy and NED for the rest of their lives. Because once it metastasizes, 90% of the time, it is going to develop in the liver. 90% of the time, ocular melanoma will metastasize in the liver. And once it does that, once it's metastasized in the liver, the patient has a 1% chance to live 5 years. The other place that it likes to metastasize is in the lungs. Now, there's a really cool guy named Clay Butler. He's on YouTube, and I'm going to post some of his videos on my news feeds and on the website. And Ashley McCrary introduced me to him and explained, that he's done these really good informative videos, and they really are. But he explained it the mastatize, that I am working hard on this word and the forms of this word, and I get it crazy confused every time. But once it metastasizes in the liver, it just becomes a game of whack-a-mole and trying to kill the lesions that pop up in your liver as they pop up, because the ocular melanoma begins to attack the liver. But there's no cure. So any treatment is just, as he put it, kicking the ball down the road. Ultimately, this disease will win because it just keeps attacking the liver and it gets more aggressive. And the treatments, even if you find a treatment that works, eventually that treatment won't work and your organs will just shut down. The reason I went through all of that is I am learning that because I've been a person without cancer all my life, but I know people who have cancer, and I know how I respond, and I know those awkward moments and where you just don't know what to say. You love somebody, but you don't know how to be there. You don't know how to express that. But now I'm on the other side where I feel how awkward it is for the patient. So it's not fault of the person that doesn't have cancer. They're just not in that place yet, and they don't have an understanding. But especially ocular melanoma, because somebody had mentioned to me this morning after surgery that we were talking about ocular melanoma, and he said, well, what were your symptoms? And I explained, and then like I've started to do with everybody that I interact with, start explaining the importance of dilated eye exams. And then before we departed, the last thing he said to me was, well, at least it's curable. To which I didn't respond at all. It was one of those moments where I just, but it was a reminder to me as well, that people just don't understand. They don't know. And hopefully through my journey, hopefully I can bring awareness, and hopefully there will be testimonies that will give evidence to me making a difference in ocular melanoma awareness, even if it's only to myself, because it felt really, really good this morning when my pre-op nurse mentioned to me and told my wife, well, she said to me that she was really glad that I advocated to her, and that she's gonna definitely do it, because she mentioned to me that we're talking about the sun and UV rays being involved in ocular melanoma, and me explaining, as far as I know, they don't know a cause. It's not genetic. It's random. It's extremely rare. 6 in a million people will get ocular melanoma. And for people who don't work in the field, just average Americans, average people in the world, it's a very high likelihood that you'll never even meet or know someone that has ocular melanoma. Ashley McCrary, who is in Alabama, they say Alabama, there are 30 people in Alabama who have ocular melanoma. But what touched me is we were talking about UV rays. And she says that it really makes her concerned for her husband because he used to be a pilot. And so he was above the clouds and always exposed to UV rays. And my response was get a dilated eye exam and make sure that they dilate his eyes and you get a dilated eye exam, because when they dilate your eyes, it allows the doctor to see the back of your eye. And you need to make sure that you ask the doctor if you have any freckles, any hemorrhaging, any spots that look abnormal. And whether the doctor is concerned about it or not, you need to take a mental note. Just like if you have a freckle that your dermatologist is watching, you need to take a mental note. And a dilated eye exam is not expensive. It does cost extra when you go into the eye doctor, which is why a lot of people opt out. They just get a regular eye exam, get their eye prescription, and go away. But they don't know their eyes. Most people could not tell you if they have an eye freckle in the back of their eye on the choroid layer. But if you do, if you ask your doctor, do I have any freckles on the back of my eye, and they state that you do, you need to be persistent and watch it for any changes whatsoever. Because Dr. Minturn told me that, and I've heard it many, many times, that he thinks I probably had a freckle on the back of my eye, that at some point it decided to just start growing. And I'm lucky it started growing where it did, because it did affect my vision, which alerted me because I had no symptoms. Never had any pain, eye pain, not just nothing, until my vision started getting blurry. If it had been further away from the macula, it would have been a lot longer before I realized that I had it, and it would have been so much bigger, potentially. So, in that conversation, she's like, well, I'm going to start getting a dilated eye exam too. And I said, if they find anything or tell you have a freckle, you need to do it once a year and just watch it, monitor it, even if your doctor's not monitoring it. And then we went on with what she was doing to prep me for surgery. And then at the end, she was like, it felt really good. It felt like, okay, this person is going to do something that is extremely important for their health and their safety and their health knowledge, their health awareness. And I influenced that. And it felt really good. So it's through those testimonies that people actually, they heard the importance, which it doesn't have to be dragged out like I dragged it out. You can have a 15-second conversation with someone, a 30-second conversation with them, and get the point across that dilated eye exams matter, and they're very important. But when you start to influence people to actually get it done and to inform people about the disease and where it starts, and you impact them enough that they take action, wow. From the place that I'm in right now, I feel like that's a reward for me taking this journey, for me on this journey. Otherwise, how do I turn this disease into something positive for myself, for my wife and my family, for other people. I don't know. But that's what I'm going to be working toward. Ocular melanoma awareness. The past few weeks since my diagnosis, I've really been obsessed with it. And I've put some ideas together that I hope will launch in a few weeks, and I can really put myself out there and connect with people who are trying to make a difference in their own way. I want to collaborate and partner with people who are trying to help and support patients and doctors and research in order to educate and inform people to know more about their eye health. You know, we all have eyes. Our vision is so important, and you don't think anything about it until it starts to fade. In my case, there's a lot more fading away than just my vision. I hope I can help somebody, but we'll see. I have a lot to talk about. It's about 47 minutes in, and I've done a lot of rambling, but let me tell you, the most successful podcasts on YouTube do a lot of rambling. It's just structured rambling, but it's no real content. It's no real information. It's just talking. But for me, it's documenting. It's documenting my thoughts and my feelings, my journey. That someday it will help somebody. You know, Clay Butler, his videos impact me. You know, he has 14 videos on ocular melanoma on his journey. But he has dozens and dozens and dozens of videos that he took where he went to concerts. And he did, my wife will tell you, every concert I go to, I damn near record the whole concert on video. And but he broke them all down into songs like I do. And he posts them all on his YouTube channel, and that was all, you know, before he was diagnosed. Well, he's gone now. And to look at the timeline on his YouTube, the timeline on his videos, the timeline on his diagnosis, the timeline on his Mets diagnosis, when the videos finally ended, and the final video that he posted is so impactful on me, because Clay's not with us anymore. He's not fighting that battle anymore. And really, it's less than 2 years. 2 years of his ocular melanoma diagnosis. But anyway, you know, those things have you think. But Clay, in his final video, I think Clay said everything that a person needs to understand about the dark side of ocular melanoma. From the patient's perspective. Super scary. Super scary. My wife, I go through a lot mentally with this. My wife mentioned a few weeks ago that I've thought about every single day since. And she didn't mean anything by it in any way. It was an observation about how people think on a daily basis about life and about dying someday. And how people think about life and dying once they've been diagnosed with cancer or a rare disease or something that they know could take their life. And initially I was like, I was taken as, I wasn't taken that she was telling me to be this way, just that's how I interpreted it, because it made me think, okay, how am I acting? How am I thinking now that I have this disease? And I felt like, okay, so should I, can I get back to that? Can I get back to living a daily life, waking up in the morning, not thinking about dying, not thinking about death, not getting heartbroken, and emotional at moments when I have the realization that I have ocular melanoma. I had the realization and understood at diagnosis, this is what I have. I knew I had it before diagnosis. I knew it before I walked into the Stanton Eye Care Center and they misprescribed me. That's going to be a video all on its own, because they have a responsibility to patients and to people. So, but I knew before that. I knew. I had the realization. But now suddenly, on a daily or every few days, I realize that something in my brain switches, and I realize it all over again. And I realize the impact it's going to have on me and my life all over again. And it breaks me down sometimes. But the reason I say that is I've thought about that every single day. And how can I get back to not thinking about the gloom and doom and be positive, right? Like normal people do on a daily basis. And I've tried to practice that. I think about it consciously, and I've tried, and let me tell you, I think that I haven't failed in that way, but I can't escape my own reality. And Clay really brought it all home in that video. That you wake up every day and your brain just goes there. And he talks about that. He talks about the difference between people who think that, they're going to live forever. You know that someday you're going to die, but you live life like you're going to live forever. And then suddenly you're diagnosed, and there's just a change in your mentality, the way your brain works, the way your brain feeds thoughts and information to your consciousness. And when you see the video, it's it really is probably the best thorough video or explanation or anything that I've read on what ocular melanoma is to the patient. So I would advise that you go over and watch that. And I just want to say thank you to everybody that I don't know, because I've only told myself, I've only told 3 people in my family that I have ocular melanoma. My wife, my brother-in-law, and my sister-in-law. There's so much that goes into that, and I'm going to do a video on that, because I have met a lot of people that are in the same, or have experienced the same conflicts when it comes to telling people that you're diagnosed with a rare incurable disease. It's nothing against my family or anyone that I know, but it has everything to do with me. But at some point I realized that I thought about the pink ribbon for breast cancer one night when my wife and I were sitting on the couch, and I was thinking about awareness, and then I decided to look up the awareness ribbon colors for ocular melanoma, and I realized they're blue on black. Like, huh. Well, that's cool. I like that. Blue on black. I love that, actually. I love the blue on black, the dark blue on black. I looked it up. What does blue on black mean? And you know, in life it stands for intelligence, strength, professionalism, you know, all those things. And I mentioned to my wife at that point, I'm like, well, I guess if I have this disease, I might as well own it. I might as well own it for myself. And I got on this blue on black kick. Now I'm obsessed with blue on black. And that's how we're gonna tell the world about ocular melanoma. Blue on black and eye patch challenges that Ion Cure and Ion Grace Foundation put on. The eye patch challenges. May is Ocular Melanoma Month. Cancer Survivor Day was just a few days ago. Blue on black, baby. That's how we're going to tell the world about ocular melanoma. But when I told my wife that if I'm going to have this disease, I might as well own it, started, you know, thinking about a blue on black awareness campaign and how I could do something like that. And I forgot my original point why I brought that up. I really did. And I'll remember it when I end the video, but it led me to, this discussion led me to something else. How, you know, my wife mentioned that, hey, maybe next May, you know, we can just start a walk. Even if it's just me and you. Or because Ocular Melanoma month is in May. And I don't know why we have to wait till May, but that's what that would be the best. She's like, even if it's just me and you, we'll get together, we'll walk, and have an annual walk here in our hometown. There's a regional rally for cancer that happens every year. That's an annual fundraiser for cancer. But there's nothing really localized for it. But I thought that was really cool. And then my wife come home from work one day and said, "Oh well, we're they've always had this Friday jeans day, right? Where you give $5 and you can wear jeans. Oh no, not jeans day. It's you can wear during football season or special event, special holiday."
Blue jeans for $5.
I thought it. Oh, so you don't have to pay to wear your shirt. Oh, okay. On Fridays they wear whatever team is playing during the football season. Go Irish. $5 to wear blue jeans on Fridays. But somebody mentioned that they're gonna do something coming up here, and they need any suggestions for the donations to help an organization. And so she suggested, all on her own, so proud of her, so proud, so deeply proud, and just love my wife for her heart and her intentions. She's such a good person. But she's like, well, how about Ion Grace Foundation? Well, what's that? Well, they help patients that have to travel for treatment for ocular melanoma. So that'll be actually our first fundraiser for Ion Grace Foundation. It's all on my wife. I have nothing to do with it. But in my mind, I'm thinking about how I can organize dozens of different fundraising events to benefit Ion Grace Foundation, to benefit A Cure in Sight, to benefit the Blue on Black Foundation, and to promote ocular melanoma awareness through the Blue on Black ribbon. So that's coming real soon. Still can't remember my original point, why I went on that damn near 10-minute discussion about Blue on Black. But I am now at 1 hour and almost 4 minutes, so that's good. That's a podcast, baby. I'm not even going to edit it. I'll rewatch it at some point and then probably upload it to the channel. Listen, any patients, any caregivers, anyone who is willing or has anything to say, anything to add to the conversation, to the discussion, to support ocular melanoma patients, caregivers, doctors, nurses, researchers, advocates. The most important, the number one thing is, it's not about it's about hitting record. Record it, upload it, share it on Facebook, share it on YouTube, share it on Instagram, share it anywhere you can share it, but hit record. Listen, people worry about lighting, people worry about audio, people worry about the production quality, but it's not about that. It's about the message, and it's about the willingness of people to just hit record. That's something that's been hard for me, and probably, it's a lot of people's, in their top 3 reasons to not hit record. Number 1 reason, nobody wants to be recorded. They don't want to be on And I want other people. They're not comfortable. I'm in the same boat. And then production quality. Oh, well, my lighting, I can't get my lighting. I don't have studio. Same boat. But at some point, if you change your way of thinking to understand that it's all about the message and reaching people, whether it's one person, 10 people, 100 people, whatever, the most important thing is to just hit record. So this video is an hour and 5 minutes long, and I'm going to try to cringe myself through it because I hate seeing myself on video. And I'm going to try to upload this entire video, but then not delete it, because I've uploaded dozens and dozens and dozens of videos. I've uploaded quite a few videos on ocular melanoma and deleted them because I go back a few days later and I look at it and I'm like, ugh, I cringe myself. But something that I want to do is get it out there, because when I'm gone, for whatever reason, I feel like this is important, and we'll see what we can do with Blue on Black awareness of ocular melanoma, the importance of dilated eye exams, and encouraging people to make eye health a priority. Using the slogan, "Know your eyes, they see everything." I hope to see you soon. I hope to talk to you soon. And I hope in some way you get a little piece of something out of this video. If you would, like and comment, subscribe to my channel, and share this video with somebody that might get a little something out of it. Thank you for watching. Thank you for everything you do. Thank you, Ocular Melanoma community. I love you all.